Good evening, everyone, and thank you so much for joining us. I'm Alexia Hudson Ward, Associate Director of Research, Learning, and Strategic Partnerships for the MIT Libraries. On behalf of our director, Chris Berg, I'm excited to welcome you to our hybrid event, Combating Science Misinformation. Before we begin, everyone, I'm going to ask you to place any device that rings, barks, chirps, or chimes into vibrate or silent mode. Our event tonight will be recorded for future viewing. Thanks and gratitude are extended to the MIT coordinating team for tonight's events, the library's coordinating team, Claire Berman, Carrie Peterson, Lisa Horowitz, Sylvia Figueroa Ortiz, Kathy Paris, Aya Fujitsu Ross, and Rob Kaplan, along with our recent library's retiree, Nina Davis Millis, and Jennifer Greenleaf, former MIT Libraries liaison librarian who recently transferred to the Lincoln Labs. Thank you so much for all of your hard work on making tonight's event successful. Everyone, the event's flow will go as follows. After my introduction, we'll have a presentation from our speaker, brief reflections on our presentation from our moderator, and then we'll move into a dialogue with our speaker and our moderator. After the dialogue, the floor, both in person and virtual, will be open to your questions. Our speaker this evening is Dr. Vish Viswanath, who is an international expert on the nature and scope of disinformation and misinformation about science and how it especially impacts marginalized communities. He is the Lee Kum Kee Professor of Health Communication in the Department of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health and the McGraw-Patterson Center for Population Sciences at the Dana-Farber Cancer Institute. Drawing on his leadership as chair of the National Academies of Sciences, Engineering, and Medicine, NASEM's Consensus Study Committee on Understanding and Addressing Science Misinformation, and his extensive research on health communication, Dr. Viswanath will connect trust in science with public health policy and practice, and will also review solutions to combat misinformation. Dr. Viswanath holds several key administrative and scientific leadership roles, including faculty director of the Health Communication Core of the Dana-Farber Harvard Cancer Center, director for the Center of Transactional Communication Science, also within the Dana-Farber Cancer Institute, director of Harvard Chan India Research Center, director of the Lee Kum Shung Center for Health and Happiness, Harvard Chan, and the founding director of Dana-Farber Harvard Cancer Center, Enhancing Communications for Health Outcomes Laboratory. After his presentation, Dr. Viswanath will be interviewed by Dina Rahman-Insi, a freelance journalist who is one of MIT Knight Science Journalism Fellows. Her work has appeared in Science Magazine, Nature, BBC Future, Mangalam Bay, The Science Christian Monitor, Undark, Sapiens, Rest of the World, and other outlets. From her home in rural Sumatra, she has written stories at the intersection of science and society in Indonesia, the Global South, and the Islamic world. In recent years, she has focused on covering science policy and the suppression of science in Indonesia. She has received support from National Geographic, the International Women's Media Foundation, and the Pulitzer Rainforest Journalism Fund for her reporting on the environmental crisis in Indonesia. Please join me in welcoming first Dr. Vish and then next Dina for their remarks and discussion. Thank you so much for joining us.
Great. So first, let me thank you for inviting me and for having me over. It's such a delight to be here. And I must say, you're amazing in terms of organizing your detailed emails, which I ignored mostly. My fault. So If the blood pressure is high for the team and the staff here, it's because they have been dealing with me for about, I don't know, 9 months, waiting for me to provide information, which it's worse than a CIA secret. It was dribbling out of me, So my apologies if I caused anxiety and stress, but you have been very patient, very organized, so I'm very grateful to you. And as I was saying earlier, maybe this is the only way I can get into MIT, so like talk like this. So I'm happy to be here, delighted to be here. Just in the interest of full disclosure, you mentioned that I chair the Consensus Study Committee for the National Academies on misinformation, addressing misinformation in science. So unlike other National Academy committees, consensus study committees are confidential, the deliberations. So I cannot reveal what has been transpiring until the report comes out. And I'm happy to talk about it in general, but I'm drawing a lot on my work and the work of others to engage with you in this conversation. So the issue, I think, for us is those of us who are engaged in science and health, in my case, the question is who is actually translating this information for us. So we as scientists, we are in the business of knowledge production. We generate knowledge, and we are very clear. We are very clear with our hypotheses, and here is what we learned. But then what happens after that is a real challenge, right? So the public, or I would say the publics, how are they learning about science and health and other topics, right? So, but there are a lot of people who are between us, the gatekeepers, the translators. So one of them, so I want to start with an example. So just take COVID. And this was a search we conducted on PubMed. It's a gross search. What I mean is it's a crude search, just COVID on PubMed. And you can see the number of citations that popped up, right? About 200,000 in a very short time. Now, obviously, this is a very crude search, but it's an indication of the pace at which we are producing information and knowledge, right? And also, and this is only in PubMed and a lot of duplications, right? But then we rely on people like Diana to translate it for us, and when there's a lot of great reporting out there, people who either are science journalists, health journalists, technology journalists who communicate with the publics, mostly, occasionally also miscommunicate with the public, but most of the time they're trying to do their best. And we work with reporters, especially when we think we have this brilliant innovation or brilliant finding of some kind of paper. But the private sector is also in the business of health and science communications. If you think about it, so we are saying one thing. The private sector is also saying another thing about the same facts. Facts are same, right? But the contestation is very different, whether it is sugar-sweetened beverages. I know you're all looking at Taylor Swift, but it has nothing to do with it. I'm focused on SSBs, sugar-sweetened beverages here, whether it's vaping, whether it is fruit juices with tons of added sugar, or of course, my favorite, tobacco, right? I think I'm on every tobacco company's enemies list. So just I'll give you nothing against Coke or McDonald's or Marlboro. Everything against Marlboro, definitely. But just give an example of this is what they spent on marketing, right? And these are dated. We have more recent data too. But the tobacco industry, as an example, spends $10 billion a year on marketing every year, only in the US. Now, we can't get those data from other countries. Fortunately, because of certain legal rules and compliance issues, tobacco industry has to declare how much they spend on marketing. And they claim, well, we only focus on brand switching, but we won't go there. The point is, $10 billion, as one senator said, $1 billion here, $1 billion there. Pretty soon we are talking about real money, right? So this is a lot of money on marketing. What are they saying? When we talk about what tobacco does to human health, and you can say the same thing with McDonald's or sugar sweetened beverages, etc. Right? So this is what we are competing with when you're translating your science and health information, right? And then of course, the other group that is also very active is activist groups, right? Now, activist groups can work in both ways, right? People who are interested in science and protection of public or publics, but also anti-vaccine groups is a good example of that, or people who have objections to GMO, whatever, right? A topic of the day. And they are also in the business of interpreting science and health information, right? So we are working with them too. So here is an example of vaccine groups, with Jenny McCarthy, talks about vaccines. I don't know how many of you have heard her speak. For some reason she's more popular than I am. So more people pay attention to what she has to say than those of us who work in. I have spent a lot of my time in working on vaccines and communications, vaccine communications, and you can see that here, right? So and the interpretation. And this one is very interesting. It's called the National Vaccine Information Center. How many of you are familiar with NVIC? Okay, so the name sounds so official, right? National Vaccine Information Center, right? Look it up when you have time, right? They're one of the most powerful, not now, now you have to pay attention to my talk, but NVIC actually has, it's amazing how much they use science, health, graphs, charts, everything to talk about the dangers of vaccination, right? And it looks very official when you go there with all the data, right? So it's quite impressive what they try to do in a negative way. So, and then I just put this in for as a story, so because I got this call. I have been doing a lot of interviews during COVID around these issues, and then somebody called me and said, "Oh, do you know this story about this guy in Florida who's doing the data analysis for COVID?" I said, "No, I don't know the story." He said, "Look it up. I want to talk to you. Why don't you read about it and come back, and then I want to interview her." And then I looked it up, and this guy is a former Uber driver from Ohio who was appointed as an analyst, data analyst by Florida, of course, and nothing against Florida, by the way. Don't mistake me. The government, as you know, has been very vocal about these things, and he's a blogger, talking about science and health, and talking about how everything you can say about why vaccines are not desirable, while social distancing should not matter, and on and on. So, and he has a following, right? Anybody can open a blog, and you have a following, and so he is also in the interpretation business. And then, of course, the penetration of information and communication technologies. Social media is one example of that platform. Is now anybody can be a producer and a disseminator of information on science and health. At one time, we had barriers to entry, right? You had to have a media organization, you had to own it to publish and disseminate information. These days, anybody can do that, right? So if you look at the penetration, particularly with social media is a particular challenge. I'll come back to that maybe in the Q&A. So, if you take about, who knows what the actual numbers are, maybe only the social media companies know this, but there is an estimated, close to 5 billion people in the world. There's a population of only 7.8 billion people, so about almost 5 billion, 4.76 billion are on social media. And they're all very active in varieties of ways. And now they can also produce this message. I won't show this, but I have two videos which actually I should have alerted you early on, so but I won't show it because it will take up time. But essentially, maybe when I can send the URLs around, you can take a look at it. This video, it was flying around WhatsApp, which talks about how the Chinese government made a decision to shoot all COVID patients because they're endangering healthcare workers. Think, right? I mean, think about this, right? And this goes through a hospital video. Hospital must have been in Mass General or Dana Farber somewhere. You can see it's an American hospital or a European hospital, right? But if you don't pay attention to the visual cues, you think this is a Chinese hospital. And then the next thing, actually, maybe I'll show it for a second.
Virus patients to avoid further spread. The highest level of court in China, Supreme People's Court, is expected to give an approval on Friday for the mass killing of coronavirus patients in China as sure means of controlling the spread of the deadly virus. The state tells the court that China is on the verge of losing its health workers to coronavirus as at least 20 health workers contract the virus daily. The state argues that coronavirus patients admitted at hospitals only have their deaths delayed and infect many others while receiving care at the hospital.
Great, excellent, thank you. So it's a 4-minute video, but you got the gist of it, right? The Chinese government made the decision, right? Okay. And then you see this video.
Okay.
Okay, so the point is, it can, if you're paying attention to the visual cues, right, you will say, oh, this is nonsense, right? But remember, it's on social media flying through, right? How much attention do you pay to things, especially if you disagree with China, your prior beliefs can influence how you process this kind of information, right? So this is the kind of stuff that goes through social media. Nothing stops me. If I have to do it, I have to go through gatekeepers and journalists like Diana. But if I am putting it on social media, there are no gatekeepers, right? Virtually, I can just do it. And I can show you 500 other examples, right? So here is another example of misinformation. So I don't know whether you know it or not. That's why I'm standing up and drinking my coffee, right? You don't stand up and drink your water. So that's not good for your health. Or I don't know if you're any doctors. The class I teach, I have several students who are doctors. So I tell them, why are they wasting their time? For what? Medical school, undergrad college 4 years, medical school another 4 years, plus fellowship. Total waste of time. They can do it in 7 days. And by the by, if you actually click on it, you go to Apple iTunes stores where there's a curriculum there. There's actually a curriculum. Day 1, you will talk about something. Day 2, something else. Day 3, something else. 7 days, you're done, right? So again, these things keep spreading, right? So what I'm trying to say is the business of science and health in terms of translation, it's just not by scientists who have credentials or our communication people in the institutions of scientific labs, but there are other groups which are paying which are actually playing a significant role in this communication. So you can imagine what kind of a challenge it is when we talk about misinformation, right? So, and the other point I want to say is that information is not communication, right? Just because there's a lot of information out there, I started my first slide with that, that doesn't mean communication is establishing a common bond, a common set of information principles, framework, right? And that's where we come with this idea of misinformation, disinformation. It's very difficult to know whether disinformation and misinformation is often difficult to distinguish. But if you take, I want to take 1 minute to say, misinformation, how do you define it, is a real challenge, right? If you think about COVID-19, and if people said, let's take one hypothesis, right? I won't go through all of them. Like origins of COVID. We initially said it was some wet market in Wuhan that has potentially led, or was the origin for COVID, right? It's a hypothesis. And if somebody said, no, it came out of somewhere else, we have dismissed them as conspiracy theories, etc. And then now we are saying, well, it's a reasonable hypothesis that it may be from somewhere else, right? Including, I think even Dr. Fauci was saying that, right? Maybe we were too eager to dismiss alternative hypotheses, right? So if it was misinformation, if you offered an alternative hypothesis at the very beginning, right? But today, you won't dismiss it as misinformation, right? So I want us to be cognizant of how the evolution of science, right, how science evolves on any given subject could potentially influence what is misinformation or not, right? So in a sense, what we're saying is it's false information, it's inaccurate information, right? It's false in terms of we are able to verify it to be false, right, or incorrect, right? And then there are other sister cousins of this, disinformation, when it is intentionally spread by somebody, shared by somebody. And Claire Waddell, wonderful person, professor who talks about malinformation, information being spread with malicious intentions. Not all disinformation is malicious, not all misinformation spread is malicious, right? So the question is this a problem? You think it's a problem, that's why you invited me and you're holding this series. But is this a problem? Right? This is what, you all agree it's a problem. Good. I'll disabuse you of that notion pretty soon here, right? So, okay, now this is interesting, right? We are all worried about it in many ways. The question is, why do we think it's a problem? Negative outcomes, absolutely, right? Social media are being blamed quite a bit, information and communication technologies. We are worried about AI and bots and everything else, spreading it even more. We are losing control over how we spread scientific information, right? That's the reason we think it's a problem, right? So, and we are, of course, worried that it is having these negative outcomes, right? So, and disinformation is particularly worrisome because this was in the early stages of COVID when one study that came out of CMU, Carnegie Mellon, which said 50% of the spread of misinformation was most likely from bots, right? I mean, that's the extent to which we can be assertive, most likely, rather than definitely, right? And the consequences, now this is what you meant, could be serious because number one, you could get confused about, say, disease causation, etiology of cancer. This is one of the surveys we did. More than 50% of the people answered that everything causes cancer, right? So when in a public opinion survey, now that's a problem. Or 15% said nothing could do. a person could do to reduce the chance of cancer. We know that's not true. In fact, epidemiologists, my friend Graham Colditz and others have published papers which showed 50% of the cancers can be prevented, right? You take the right steps, healthy eating, not smoking, physical activity, not abusing alcohol, etc. Screening, appropriate screening, you can, and vaccination these days, we can prevent cancer. So there is a wrong or understanding of the disease etiology, inaccurate understanding of the causal attributions people make are very interesting, right? Even during COVID, we would initially said, oh, let's put the groceries aside until they, we can sanitize the groceries before we can consume them, right? So, and then of course, we were encountering a lot of this. Eating garlic can prevent everything. Actually, garlic can prevent anything, depending on the culture and the country. Hand dryers are effective in killing the coronavirus. That was the one that was going around. Bill Gates is planting microchips. I mean, you can go, you all know, you have heard of all these things, right? And this is a study we did. It's a busy slide, but essentially it shows that we measured beliefs, misinformation in terms of knowledge. If you have higher knowledge, you are more likely to stay home, keep a safe physical distance, wash hands, use face masks, clean surfaces, and have higher efficacy. If you have lower knowledge, you are unlikely to do that. These are odds ratios, right? So these are, again, speaks to what you said. So we fear some consequences to this. And then sometimes misinformation can be mainstream, right? So you take the hydroxychloroquine thing, right? Initially, when it was proposed in a small group of, I think a doctor and a small group proposed it, nobody paid any attention to it until President Trump held a press conference and started talking about hydroxychloroquine. The next thing you know, it's all over, right? That the kind of a, it mainstreamed this particular quote-unquote treatment for COVID. Ivermectin is another example of that, right? People were trying in medical journals, and then it got mainstream, right? And that amplification is another problem, I think. So what are the impacts? The impact of misinformation can be studied at two levels, I think, right? So one is at the societal level, right? Which is, I think most of us are worried about the individual level. I'll come to that. But at a societal level, it could be, right? One of the things we are worried about is trust in institutions, right? So people have become more skeptical. People have become even more cynical of media institutions, scientific institutions, medical institutions, certainly our politics. I think that's a broader worry we have, that this general trust is eroding. And I think if that erosion of trust is what's scaring most of us, right? So it's just not the individual case where somebody is driving all the way to Virginia suburbs and to look at kidnapped children in a pizza shop. I mean, that's kind of a I don't know. Do you know what I'm talking about, that incident? So that's not. This is the institutional aspects is what worries us. Politics, obviously, we are worried about polarization, and even disengagement because of that kind of a cynicism. And we are concerned about market stability. This happens all the time, right? One rumor is sufficient for a company to go under, and depending on how agile they are enacting it. So there are these broad societal level effects that we certainly are concerned about, why we are paying attention to misinformation and disinformation. And then we have individual level effects. If misinformation leads to misbeliefs, that's when it matters, actually, right? misinformation, we are encountering misinformation all the time, all the time, right? But if it leads to misbeliefs, wrong beliefs, then you start worrying about it, right? And there are scores of these examples of those misbeliefs. I showed you a few, like a garlic or lemon, whatever, right? Being treatment, hand washers. But the question then is, how do you correct it? And we can talk about it in the conversation. It's not as easy as we think it is, because you have to correct misinformation without engendering cynicism or skepticism, right? How do you do that is a real challenge. That's what we call a backfire effect, And then when people encounter misinformation, then they start worrying, okay, what is truth? What is lies now? Can I trust anything that comes across, or should I think all of these are lies? Especially, you saw that during COVID, don't wear masks. And then, oh, no, you should wear masks, right? And people said, what the heck? Can't you make up your mind and tell us what we are supposed to do? We are not scientists. Just tell us what we are supposed to do. But there are reasons why, but I think that potential exposure over time could lead to that kind of a failure to distinguish. And then, of course, in one way, misinformation, one aspect of it is we share very freely, right? It's kind of we are finger happy, right? So we do that, right? And then we forward it in a second, right? And it takes me 10 seconds to forward it, right? So I don't know about you, but if you are from abroad or work abroad a lot, people use WhatsApp a lot. I think it's much less in the US, but most of us are on WhatsApp. You should see, it's amazing the kind of stuff that comes out. I was about to use another word, but I won't in a polite company. But it's just, I gave you some examples on WhatsApp, right? And those videos came through WhatsApp, right? So, and so that sharing is important, because that's kind of interpersonal behaviors that are contextual. And then, of course, it could potentially lead to some behavioral issues. As I said, I won't get vaccinated, as one example, right? So one aspect that is very critical is a trust issue, right? And we all spend a lot of time discussing, trust, because trust will allow you to engage with that information, right? And what's happening is, this is a busy data slide, forgive me for that, but a lot of people have been worried about it, right? It's very interesting. If you look at the data, doctors are one of the most trusted people. They still are, right? Despite what we think, 90% of the people trust doctors, hospitals. Look at where science and researchers are. They're still very high, right? These are public opinion data, right? These are very reliable data. And this is global, by the way. I took out the slide which have global data. We don't have time. So, but as you see, because of this increasing questioning, there has been some erosion of trust, but not as much. But that erosion is selective, right? Not everybody lost trust, right? I mean, yes, doctors a little bit, scientists a little bit, but mostly state governments, police. Think about it. Police lost a lot of trust. Question is, this was in 2020, right? It was also the time, 2019, 2020. Is it because of misinformation? Or is it because remember, there was a turmoil in the US with the George Floyd murder, and people were protesting, right? So it may or may not be because of misinformation, right? But the point is that trust is very high in doctors and scientists. Why trust matters? Again, very busy slide. One take home from this. If you don't trust, if your trust is low, you are much less likely to get vaccinated wear masks, etc. If your trust is high, you are much more likely to comply with the recommendations, right? That's the take home from this. And then each of them, it also varies by institutions from where with the trust. If hospitals and doctors, much less worried. But if it is Fox News, Donald Trump, they're much less likely to comply, if followers, etc., right? So the reason I'm giving this slide is because we assume misinformation has this overarching bad outcomes, but we have to be much more careful in qualifying it. We need the data to look at it very carefully, right? And then there are inequalities. My heart is here in studying inequalities. COVID brought to the fore inequalities in the country. I won't go through every slide here because the point is very clear. In our country and globally, there are tremendous differences, inequalities in risk conditions people are exposed to, as well as communication inequalities. So whether it take vaccination, whether it or any other COVID measure as an example, even in health, whether it is, so for example, on breast cancer, right? Fewer African American women actually contract breast cancer, right? But they die more. Simple issue of access to services and racism, institutional racism, right? So you can see this, whether race or class or place make a tremendous difference in these inequalities, what we in our field call health disparities. My community partners hate that term, right? It's inequities designed, right? So in communication too, people think everybody has a cell phone, so what are we worried about? Everybody should have access to information. For the last 20 years, we have been documenting in our lab that there are differential access to information among different social groups and differential capacity to act on that information among different social groups. So I won't, in the interest of time, I won't go through every datum I have, but the data I have clearly show here. So this is an example. If you look at the knowledge of scientific knowledge, say for example, it shouldn't surprise you. More educated you are, formal education or schooling, greater the knowledge, right? But and look at the race too, right? Whites are more scored higher than blacks and Hispanics. More critical, and this is important, the intersectionality issue. Even among college educated, blacks scored less, Hispanics scored less than whites. In fact, if you look at the data carefully, this knowledge or score of whites with less than college is higher than knowledge score of blacks with college degree. This is what we call intersectionality, right? Where two factors come together to highlight and amplify an effect. This speaks to the distribution of societal resources, of education, for example, as one example of this, right? So, and most of the work on intersectionality came out of feminist literature because they have been, like women get same qualifications, they get paid less, right? Is an outstanding example of that kind of a discrimination. So race and ethnicity matter. There is an interesting story on COVID. If you look at the early days of COVID, we couldn't get data on race and ethnicity and how they are disproportionately affected. Initially, all the data, this is what we call as data absenteeism. All the data were on higher educated white population, right? My community partners were complaining, people are dying in our community, nobody's listening to us, we don't know what is happening. One of the most inspiring examples came out of Chelsea, our neighbors here, right? Who organized themselves, the Chelsea Collaborative, and said, pay attention to us. You want to collect data on morbidity and mortality? Come here. report on what's happening in our community, right? We will work with you, right? This is the issue of data. Representation matters. I have a partner who works with a research partner who works with the Native American community. And she told me, Vish, I was interviewing her. She said, in our community, it's an issue of data genocide and data sovereignty. You have the data, they don't give it to us, right? And so data matters, and so race and ethnicity matter. And this is another inequality. We sent home kids, we sent kids home and said schooling will be through Zoom. Think about it. If you have 3 kids, 1 computer at home and no broadband, what kind of education are we providing, right? And then they said, oh, don't worry, we'll provide notebooks, they can take it home. But what about broadband? It costs anywhere from $30 to $300 depending on where you are. And there are communities within the city of Boston who don't have broadband access. There are neighborhoods, right? So that's an inequality that people don't pay attention to, right? Communication inequalities, whether it's on science or other things, right? That's what I meant by data absenteeism. So what can we do? What can we do? So at the, what I would say is it requires multi-sectoral approach at a number of levels. And this slide is very academic, right? But it's important to know it's not about telling people and putting the responsibility on people, say, thou shall get only correct information. It just ain't going to work like that. If we are serious about addressing this, we have to address it at a number of different levels, from interpersonal to organizational to community to government and policy. I'll give you one example of interpersonal. Well, I can do it in a conversation since we are running out of time. Individual level interventions, fact checking is one that can work if you nudge people. Pre-bunking, you tell them you are going to hear this kind of information. Now, anti-vaccine forces will come out and tell you about Bill Gates and planting a microchip. Don't believe that, right? This kind of a pre-bunking and debunking. Nudges work. So if you go on Facebook and you are doing something with COVID, you will get a nudge. It looks like you're looking for COVID information. Here is a reliable place to go to, right? And literacies, right? Numeracy to digital literacy, health literacy, science literacy could be promising. But to me, the structural level is most important, I think, right? We have to somehow address at the supply level, right? At the distribution level and the demand level, right? Otherwise, it's very difficult to do that. This is by Kelly Bond. This is very busy. But there are a variety of efforts now we are trying to make, because most of the attention has been to this kind of an individual level. We'll get fact checked, But if you want to have a massive impact, you have to do it at this level, right? Content moderation is one example. It's very difficult for you and I to do it, but one possibility is the social media platforms have the ability, right? They could do that, privacy protections, again, platform level laws, user controls, right? These can be, we can technologically design them. So you can see antitrust, etc. And even laws can be helpful, appropriate laws can be helpful. So the idea of what I'm trying to say here is we focus on individual level solutions, which are good, which work very well. But if you want to do it at scale and have a larger impact, we have to look at this kind of a, supply, distribution, and demand level to have a larger impact, And the last thing is, we involve in everything we do in our research, right? Community partners, collaborative research with community partners, because we can design interventions from the top down. At the end of the day, people work with the community organizations in their communities, right? I mentioned Chelsea as an example. So people go there and work with them, right? So we do collaborate, and we work with our community partners, engage them, right? So this is one example. We have a cancer control intervention in the community. We created this intervention to train our community partners to promote cancer control efforts, say screening in breast cancer, anti-smoking efforts. We designed the entire intervention with our partners at the table. We are co-production of knowledge. And then they told us, oh, by the by, we have a problem with COVID. What do we do? We immediately pivoted from cancer to COVID information, right? That's the kind of thing we do, right? And we provided a lot of information to them, working with our community partners. Created a dashboard. This is for the journalists. We also created a dashboard for the journalists. And we created in Spanish, Portuguese, and English these infographics for them. And what they did, which is very interesting when we created this, said, this is great, this is what we want. But one community partner told us, nobody will come to your website from my group. Print the infographics for us. I have a week, every week I have a food pantry. I'll put it in the grocery bags. We would never be able to think of anything like that, except our partners are brilliant, right? That's what co-production and co-distribution of knowledge can do for you, right? They are the experts. We are not the experts, on these kinds of things. So I will say the other is that's why our science should be participatory and inclusive. We try to do it everything from top down. This is an example of where we engaged people to provide data for us. Particularly data absenteeism can be addressed by asking people to provide data, because most of the people are ignored. Most of the people I'm interested in, vulnerable audience, are ignored. They participated with us in providing data through a smartphone app. I won't go through all the details for it. Right? The bottom line is there is a lot of exposure to information, but it's very difficult to separate the signal from noise because there is a lot of information also out there. How do you does all misinformation matter? We don't know. The other issue to think about is correlation. Is not causation. So I gave you the George Floyd example, right? It may be the churning in the society that led to cynicism, not just misinformation, right? So we have to be careful in documenting it, right? But what we can do is we have 50, 70 years of communication science. We can draw on that communication science to construct messages and work with people. We have to engage, science of engagement. We have to work with partners, not on our own. That's why I talk about participatory science. Use community strength and assets. Communities are not weak. Our partners are not weak. They have tremendous assets in the community. They have credibility. We have to tap into that as we address this. We have to build resilience to misinformation. And we have to acknowledge that the expertise doesn't lie only with us, but it's diffused. It's also with others out there. We have to tap into that to develop these solutions, I think. So I'll stop here. I've gone over a bit. My apologies, but obviously I am the person who's standing here and mouthing off, but these are the people who do the real work. Thank you so much. All right.
This.
Go ahead.
Okay. Okay, Bismillahirrahmanirrahim. Thank you very much, everyone, for coming, and thank you, Vish, for such a lively presentation and so many insights that we got from there. So let me start this Q&A session with a recall of my reporting back in 2019. So it was when the Indonesian government wanted to vaccinate millions of children across the archipelago with measles and rubella vaccines. At that time, parents were horrified because they read in Facebook and WhatsApp that the vaccines contains porcine, which is a compound derived from pork, and that is not permissible in Islamic creed. And knowing this, the Indonesian Muslim Scholars Association admitted that there is this compound in the measles rubella vaccines, but the amount was very much negligible. Then they released a fatwa that these vaccines is permissible. But it was too late because the misinformation has spread so fast across the archipelago, and it reaches remote villages. The people there have smartphones, and the misinformation is not about porcine being a vaccines, but it has evolved into heaven and hell. And one parent told me that she's afraid of going to hell if she gives the vaccines. And that's what happened in Indonesia. The government failed to vaccinate the children, and a few years after that, a number of measles increases, and some of the children got blind, some died. So looking at that case and reflecting on your presentation too, like, I think it made me realize that this beast that we are combating right now is very strong. It evolves very fast, and even with intervention from religious authority and government. And Vish, do you think that you agree with that view? Is it pessimistic, or do you think that there are weaknesses of this beast that we can attack?
Yeah. So thank you. Thanks for that opportunity to clarify it a little bit more. So I think we are very pessimistic about, and we overestimate the impact of misinformation. And I'll clarify in a second here. So you take, if you take these stories, which the Indonesian example is a good example, the polio vaccination in Nigeria as another example. And right now in Florida, there is a measles crisis. And the Surgeon General of Florida, right? The Surgeon General of Florida state is saying, is not urging parents to stay home or keep the children home if they have measles, right? And he has also said a few other things about parental. But then look at the data, right? If misinformation about measles is so widespread, right? What is the proportion of parents vaccinating their children? It is still anywhere between, and these data are public, right? You can look it up on CDC. It's anywhere between 75 to 90%, right? So, and before COVID, COVID has done a job on some of these things, but before COVID, I think it was less than 10% who were refusing vaccine, less than 10% of the parents, right? So the point is, and same thing with polio, right? If you take polio, again, there are some recent cases that emerged in different parts of the world, but in general, we are pretty close to eliminating polio, eradicating polio, right? Again, with all the misinformation on polio, we are quite successful. Vaccination is a great success story. You take COVID vaccines, if with all the negative publicity about the vaccines, still in the first couple of doses, rounds, 68% of American adults got vaccinated, right? In India, they administered something like 200 million or 200 crores, I'm not getting the number, of vaccine doses, right? Despite all the negative publicity and misinformation. So what I'm trying to say is that I don't want to minimize the impact, but we have to be very careful in how we qualify it and who is more likely to be receptive to this kind of misinformation, right? Not everybody is, a lot of parents say, I'll talk to my doctor, I'll talk to my priest, I'll talk to my imam, I will let them tell me what I should do, right? But there is definitely a group out there which is much more receptive to it because of their beliefs and values and prejudices and biases, and they will certainly be affected by it. And earlier we were talking about climate change, right? Again, we have to see who is more vulnerable to this kind of a influence. It's not that I want to minimize it, please don't misunderstand me, right? It is just that I want to be very cautious and careful in trying to figure out who is more receptive. It depends on the topic, right? It depends on the topic. In fact, we can't even estimate how much misinformation is out there. It depends, again, you have to be careful about misinformation is not very helpful. Is it misinformation about a specific issue? That's the way to think about it.
Thank you. And your explanation led me to a question about inequalities. You said that we have to think about who is the most vulnerable.
Right.
And I live back in rural Sumatra, where people around me, they are marginalized community. And you mentioned earlier that there is disparities in terms of access to scientific information. What can we do?
Yeah. So I can spend the next 2 hours what we can do or what we should do. This is what I spend my time on. See, we have a term in the health field, we use social determinants of health, that is social conditions influence the health outcomes of people, right? And education, income, place, race, ethnicity, all these factors influence it. But none of these are by accident. They're all by design. That's why I don't even want to use the term social determinants. There's nothing deterministic about it. It's by design. You take broadband connection, right, which I give. Globally, if you think broadband access is important, and everybody agrees broadband access is important because we are moving all the services to internet, you can't even apply for a service without having an internet. If you believe it's a public good, we subsidize it. It's a policy decision, right? It's a policy decision. Now, you build a road, it's a policy decision. Where do you want to build a road? You want to build a park. Where do you want to build a park? Look at what's happening in Boston. We are now debating. Mayor Wu said, we will do X, Y, and Z. Community is saying, wait a moment, we have to be a part of the dialogue and conversation, right? So these decisions are intentional and deliberate. And so one example for the communications part is President Biden during the Recovery Act, Investment Act, said we will build broadband lines in rural US. Perfect, right? Because if you're in rural America, you are less likely to have access to broadband. But there are communities within urban areas which also don't have broadband. So then what do? Is it not a deliberate policy decision, right? There are countries which have made communication policy decisions to say, we will reach out to rural areas. We'll put transmitters in rural areas. We'll develop television services for rural areas. We even taught mathematics through television to rural areas on radio, right? So to me, it's a deliberate policy decision making. And if you think that's a priority, that's what countries can do. The Green Revolution was possible because we invested in interpersonal channels of communication, the extension agents. What can be more complicated as a scientific topic than a green revolution? Applying high-yielding variety seeds at the right time, with the right amount of water, applying the right fertilizer. This is a complicated science topic, but it's been done through extension services. These people, extension agents, worked with rural farmers to do this, right? So we can do it if we are interested in investing in that.
It's interesting that you're emphasizing on this structural approach, right, for the government. Do you think that it will work all over the globe, regardless of this, government structures?
I think there are some wonderful examples in other countries. So I just came back from a conference in Curaçao. You can feel sorry for me with 80-degree temperatures and the beaches and the sunsets. So I was working very hard. No, seriously, actually, I was spending a lot of time in the hotel room and the conference place. And I gave a talk. They invited me, and I gave a talk. It was about Caribbean and Latin American countries being brought together. So obesity is a major problem in many of these countries. It's incredible the things that they are doing. The food labeling, right? They have laws now that label food products, right? High in salt, high in sugar. We can't do that here in our country. There are taxes in Mexico on sugar-sweetened beverages. We have been trying in this country. You look at I heard the speakers and the examples they were giving, they were showing. There was this speaker from Barbados. In fact, I was sharing that story with someone this morning. It's amazing what they are doing in Barbados, on nutrition lunches, school lunches for kids in certain age group. And the lunches they are serving are so healthy, intentionally deliberated, despite all the pressure from the industry, right, including taking out sugar-sweetened beverages from machines, vending machines, etc. Right. So there are more interesting examples. Nigeria is a good example. The polio in northern Nigeria, where there are initially these religious prescriptions against polio vaccine. They went to the imams and talked to them. The imams were the ones, right? And the emir of northern Nigeria in Kano was the one who was in the forefront encouraging polio vaccine, right? So I actually am more encouraged. There are some brilliant examples from other parts of the world. It's not our advanced industrialized countries are not the only monopolies on knowledge, actually. And especially, I think there is greater agility in these other parts of the world, because they have less of a legacy issues.
Thanks so much for sharing such hopeful stories. So we still have optimisms on our government and religious authority to combat this science misinformation. And going back, maybe this is the last question from me, and I will throw the opportunity to the audience. So the last question for me is about the productions of the misinformation. We know that algorithm decides what we read, what we see. So is there any technological interventions that you and your colleagues are doing in National Academy of Science in terms of combating misinformation?
Yeah, so I can't say much about the National Academies, right, the report itself, but we are at MIT, there's amazing work with technology being developed, through varieties of ways, whether it is apps and, to promote nudges or down ranking, when you're doing searches, to me, technology is not the problem, right? I mean, we are worried about AI, etc. these days, of course. To me, technology is not the problem. We are the problem, the human beings, right? The policy makers are the problem. The platforms are the problem. The industry is a problem, right? I showed tobacco industry, $10 billion. Now, the point is we have placed tremendous restrictions on tobacco advertising. Tobacco advertising is nothing but misinformation, right? So when we place restrictions, that works, right? Now there is something called Framework Convention in Tobacco Control. It's an international global treaty, which pretty much is like a menu plan. You want to introduce tobacco control in your country, here are a bunch of things you should do, right? So it is, to me, technology is absolutely critical, but more important is how to deploy it through laws, through community partnerships, stakeholder engagement. I think, and we are not losing the battle. That's what I'm trying to say. So.
Okay. Thank you so much. We are not losing the battle. Okay. Okay, that opens up for questions from the audience.
Yes, and so if you would, to ensure accessibility, rise if you can to the microphone to make sure that our virtual audience can hear you, and then I will toggle between in-person attendees and virtual attendees for questions. So I saw that there were some people with some hands raised, so if you could come to the microphone, please, and answer your question. Thank you.
Hi, thank you so much for this opportunity. I'm a vaccine researcher. I was in graduate school working with the CDC on COVID vaccines, and in my postdoc I work on HIV vaccines, and I plan to start a lab where we're going to continue making these interventions. But one part of the lab that I think it's extremely important for me to have is an arm, even coming from a very technical side of it, that's going to be public facing. I come from the south of this country, and from a family that's from rural America that have very differential educational backgrounds and political views and general views about science and levels of understanding. And I see huge discrepancies in their comprehension of basic science, their trust in information, even coming from me, or maybe especially coming from me. And I have been unsuccessful in my early attempts to convert them to a rational vaccine sort of strategy. This backfiring thing has occurred. I mean, I saw this early in thinking that scientists have a great responsibility in this problem that we have, because we have failed to communicate effectively, and we have isolated ourselves through fields of technical jargon and elitism, perceived elitism. There's so many problems. But I feel like that if it's not my responsibility, whose job is that to repair that? So what I'm thinking about are ways, maybe one up from an individual level, but including the individual level, but on a lab level, an institution level, not quite institution, but how can we build programs to increase trust, improve transparency, to help bolster the basic education system in this country so that people have the discernment to know when they're looking at false versus true information, so that we can include people in the research process so that they have confidence in the data that we have, and so that they can believe that we are here to do good and never to harm. First is never to harm. So these are super important to me, clearly.
Yes.
And I'm really glad that we're talking about it, and I'm happy to hear any ideas that you have on a way that I could implement programs to bridge that gap.
I think, there's a lot to unpack in what you said. Certainly the education part is important, I think, right? But it's not about, you take our education system, and it's about what do we teach about science? Science is not just about facts, which facts change over time, right? And teaching that part, that science evolves, knowledge changes, and you should be comfortable with that degree of uncertainty and evolution in knowledge, right? That's what we want to teach. But teaching in schools and then forgetting about it is not sufficient, right? As a society, we have to structure it that way, right? And that's why I mentioned, say, if I am from Harvard or MIT, why would somebody trust me in the community? Some conehead from Harvard telling me what to do? Nobody cares. But I work with my community partners. They are trusted, right? They have credibility. They have, I can go to them and work with them, and they will tell me how to communicate what I'm supposed to communicate, So I think there are ways we can design things. The responsibility should not only be on scientists, but we can work with our institutional media relations folks, right? With journalists carefully and thoughtfully. One thing that worries me is when scientists just go off on a Twitter or something and say whatever they want to say, assuming everybody will understand, right? You have to be very thoughtful and careful. We can get, the people get media training, some of them sometimes, scientists. So there are, I think, solutions that we can begin to implement. Some attempts are being made. I think it becomes, what we need is a more concerted effort at multiple levels, I think.
DJ asks, would you have some helpful tips for immunocompromised folks to navigate the COVID pandemic while everyone else thinks it's still just a cold and that it's over? Parenthetically, vaccination protection is poor in vulnerable folks, so infection can still kill us. Close parentheses.
Yeah, I'm not a doctor, so and people are safe. That's for that reason. I'm not a doctor, so I'm not treating anybody. But this is a really serious issue, right? I often see when I go into meetings, some people are wearing masks, and people are critical. Why are they wearing masks? Are they showing off? It's as if they are showing us up, because I'm not wearing a mask. But the fact of the matter is, people are immunocompromised. People are living with people who are immunocompromised. I think where we have failed to communicate is that kind of a empathetic understanding that even if COVID has somewhat abated, there are people who are vulnerable in our part of my lab actually sits in the Dana-Farber side, I'm all around me are cancer patients who are compromised. They can't easily get vaccination. So I think institutions have to make those decisions. So the school, my office in the school, I don't wear a mask. But if I am in the lab at Dana-Farber, then I'm wearing a mask, right? When I walk around, and it's an institutional policy. So the structure matters and helps quite a bit. And then communication matters a lot. I think, constantly reminding people, it's okay, you don't want to wear a mask. I don't find it convenient. So we all hate it, but there are reasons why there are conditions where we should wear it, because there are other people who are compromised, So a lot of it is communication legitimacy rather than questioning, It's not a very satisfying answer, I apologize, but that's the best I can do. So.
Thank you. Do we have any more questions from our in-person audience? Please come to the microphone. Thank you.
Yes, thank you for the very nice discussion. So I'm kind of interested because we talked a lot about the trust in certain groups of people, and doctors and researchers were pretty high up there. And then you also talked about this leverage points of supply, distribution, and then demand. But what I'm kind of worried about is we've seen a very big trend recently where people it's becoming more apparent within public knowledge that a lot of fraud is happening within science, and we've definitely seen that. I think Harvard, unfortunately, has been hit very bad over the recent years with a lot of scandals breaking out. And so, the number of attractions is growing exponentially every year as people it becomes really apparent that a lot of things are being maliciously spread that are not true. But they're being spread not on Facebook or WhatsApp or whatever. They're being spread through mediums which people would have high trust in, so peer-reviewed journals. And so what I'm worried about, and I'm kind of seeing, and I know this is anecdotal evidence, but people come to me and say, well, X paper has been retracted. How can we, and these were established people, with high reputation. How can we trust anything anymore, right? If that high enough level of reputation cannot prevent such fraud. So and then obviously, some people will just outright not trust researchers, but the people who understand that experts need to be consulted on these matters, if they continuously see that research is fraudulent, then it's going to seriously disrupt their trust of this research. How do you see that playing into people's recognition of misinformation versus true information?
Sure. So I have been very optimistic so far. This is a place that really worries me. You have every reason to worry. We all have every reason to worry about this. Because I think if you understand the nature of scientific enterprise, where we do years of research, then go through certain scientific processes and get it out and publish a paper. And generally, over time, there is a self-correcting process, and then we establish some trust and credibility for that particular body of work, I think. So now increasingly we are questioning that process itself, right, the process of verification. And there are a number of developments here that are worrying me. And one of them is, I think you do much more in biology than in social sciences, preprints, right, so then the question will be verification. Who is verifying what you are putting? Because now journalists have learned to pay attention to preprints now, right? Not just journal articles. And especially, I think, and then the sheer pressure of production. I gave the datum on COVID. We are producing so much. I don't know how many of those papers we published in COVID will actually stand the test of time, right? We will be retracting a bunch of them. And then now with this issue of fabrication, and I think there is beginning to be questioning. I think the questioning is happening not by people yet, because people don't necessarily understand, not everybody understands the protocols, the processes of verification in science, but there is already this elite disagreement and questioning and skepticism. And then, right, well, I won't say. So I think I'm concerned about that. So how will that spill over? I think on some fundamental issues, we may be still safe, because I'm going to talk to my doctor for some decisions. But on other issues, like distal issues like climate change, and climate change is a good example of that, right? There is already that questioning of science and scientists. So I'm worried about it, particularly with these retractions. I mean, you can say how many papers are being actually retracted, right? Very few. There are a lot of papers, good papers. But I think that the amplification of that issue is a source of consistent worry. We have to see what happens. We have to become more transparent as scientists, and bring people in. I think we used to do science in a very esoteric way. Oh, we are a group of scientists. You are our consumer of science. I think we have to open up for scrutiny, and we'll have to see what, the whole open science movement, sharing data with people, exposing ourselves to greater scrutiny, all these are absolutely necessary now to re-establish that credibility.
Can I add a perspective
please.
from a science journalist? Yeah, regarding retractions and distrust to science, we journalists, we put attention on it, especially on scientific misconducts. It's the thing that we're really monitoring. And we have, Retraction Watch. There's a publication about it where, all retracted scientific papers are published. And regarding preprints in COVID, we science journalists were cautious. At first, we weren't sure whether we should cover it or not, but at the time of COVID, everything went very fast, and then we have to inform people about what's happening, right? And then we cautiously used those preprints while consulting not only to the scientists involved in the paper, but the golden rule of science journalism is that we need to interview other scientists with the same expertise and commenting on it. So we want to make sure that we are filtering the right science. I think I second what Vish said earlier, that scientists is not the only ones who have responsibility to communicate their science. So, there are science journalists, and we will gladly want to collaborate with all of you, because we put the science into context, and I think that's the filter between the world of science and the publics, and hopefully I think we are not losing the battle. Yeah.
Yes, thank you. Chioma has a two-part question. I'll start with, considering that private individuals share science information and considering how gullible we can be, especially if our emotions are triggered, do you think it would be truly helpful to restrict social media, quote, influencers from sharing science information? Part one. Part two, also, would it be beneficial to steer actual scientists and experts towards social media and communication lessons just to help combat mis, dis, and malinformation at the ground level?
Yeah, sure. So let's take the first one on influencers. It does, I have a pessimistic answer and an optimistic answer to that, response to that. The pessimistic part is the so-called influencers. The question is, what makes them influencers on any topic? You know, I write a mommy blog because I'm a mommy, but I'm taking money from a company to market diapers, but I don't reveal it. Okay, in science, we at least have to have disclosure. I file reports annually where I take money from. But if I'm a blogger, do I declare that I'm getting money from an from an industry? What makes an influencer? Now I will be on some enemies list somewhere of all influencers, I really worry about that. You know, I mean, some influencers are great. You know, maybe they are very careful. Not everybody. Don't want to paint that with broad brushstroke, but certainly I think it is a bit worrisome. I think, you know, so because you can say anything on social media. You know, I can call myself a space scientist and I get away with it. So on the positive side, you know, if you think about this, and this is what I've been trying to say, right? Social media as a term is very misleading, you know. There are platforms. Each platform has affordances or characteristics. And not everybody is on every platform being exposed to every message, right? So we don't have to think that all of us are exposed to all the misinformation all the time. You know, we just don't have the capacity, you know, time to do that. So that is to say, we may be overestimating this impact sometimes. But who can work on it? I think the platforms have a role to play, significant role to play. So for example, I can't analyze certain data on the platforms because of API rules, or I have to pay the money. So you have to figure out how. So some things are also difficult for the platforms, right? You know, so we have to figure out what is the design of the platforms. Do we want laws in books? If we have laws on books, or on books, whatever, you know, how do they implement it? I think we have to work collaboratively, and that's what I'm thinking, right? You know, so some people are you know. So during COVID, I talked to some one very well-known social media company. They were very serious. They said, okay, we know you're doing this work. We are in India, where we have a lot of you know, popularity. What can we do to make sure that the more reliable information shows up much more than the less reliable information? They couldn't censor, but so they tried certain things in India, right? So I think we have to work with that. Some platforms are more open than other platforms, but you just have to, it's a combination of, as we said, there it's supply, demand, as well as distribution. And distribution is where I think we need to figure out, So.
Okay. So I think that's it.
Yes, Vish and Dina, thank you so much. This was a wonderful presentation and conversation. Thank you. And many thanks to all of you who joined us in person and virtually. You enriched our conversation today, so thank you. Many thanks again to the MIT planning team, and we look forward to seeing you at our upcoming MIT Reads event on April 11th at 4 p.m. here in the Nexus, featuring Dr. John Urschel, former NFL lineman and current MIT Assistant Professor of Mathematics. Have a good evening, everyone, and thank you again.